Hello, this is Robert Whitaker with Epica Animal Health. Welcome to our 6th case type in our 12 case types of Epica's HDVI technology. Today we're going to be talking about avian patients scanned with HDVI CT by Epica. HDVI CT is preferred because it captures all the anatomy. 100% of the whole density of the patient is captured. More often than not, radiographs are just not useful. And we can also, with HDVI CT, scan a patient and see soft tissue, bone, and air. Our first case today is Joey the duck. Joey is a 6-year-old duck who weighs 8 pounds, so he's a good-sized duck. Joey presents with labored breathing and an occasional honking cough. Joey is unresponsive to NSAIDs and was also unresponsive to antibiotic therapy and dewormer. So, an HDVI CT scan with a Vimago GT30 was performed. This was sent to Peregrine Radiology to be reviewed, and it appears that Joey has more than one problem. He actually has several problems. It all begins in his nasal cavity. In his nasal cavity, there is a non-aggressive rhinopathy. It could be fungal rhinitis, but it also could be some type of carcinoma. Since this condition wasn't responsive to antibiotics, low probability that it's a bacterial infection. As we move further into Joey's images, we're also going to see where there was fluid in the trachea. Something seemed to be amiss in the trachea, according to the radiologist. Could be, that there was fluid present there. So as we see his 2D and 3D images, the trachea is very well imaged in this case. And as I said earlier, we can see air, and we can see the soft tissue, and we can see the bone all in all of these images. So the next thing that we see in Joey's images are a nodule in his air sacs. So in the right anterior thoracic air sac, there is what is most likely a fungal nodule present there. And you can see this in the 2D, and also you can see this in the 3D images very well. Our next patient is Josephine. Josephine, she is an 11-year-old scarlet macaw. She presented with her right eye that began bulging, and this happened quickly. She had been to the veterinarian a couple of months before with an infection, and none of these symptoms were present then. So in less than 2 months, her right eye began to start bulging. So the veterinarian did a retropulse of the OD globe, and of course that was unremarkable. He decided to scan Josephine with his Pico HU HDVI CT, and he utilized IV contrast. He sent that case of Josephine's into Peregrine Radiology for review. This mass could be a possible abscess, or it could be a cystic granuloma. Definitely could be cancerous, but you don't know without doing a fine needle aspirate. But it also certainly could be some type of foreign material. There is a little bit of mineralized material inside of this mass. I took a little extra time with this case to show you how in the Osirix MD DICOM viewer I can manipulate 3D data from a patient scanned with a Vimago or a Pico and show different aspects of 3D images by essentially cutting away part of the anatomy so that we can see inside. How does Vimago or Pico pay for itself in avian scans? This is going to be dependent upon the type of practice that is utilizing the technology. In an avian-only practice, a Vimago or a Pico is a no-brainer. Many avian cases need an HDVI CT scan. Radiographs are more often than not unreliable when looking at anatomy in birds. So in an avian-only practice, what we see on an average is about 20 cases per month. And on an average, we see our clients charging $800 for a scan fee. That yields about $16,000 per month in revenue. If you are a general practice and you're seeing all kinds of small animal and also avian and maybe also other exotic species, the Vimago or the Pico may also pay for itself utilizing avian scans. It's just going to be that the case numbers of avian scans are going to vary. The reason they vary is because certain DVMs may never want to see birds in a general practice. Others may specialize. There may be one associate in a general practice that specializes in birds or birds and other exotics. In any general practice across the board that we see avian patients coming in and out, usually we see about 2 cases per month. And usually we're seeing those types of practices charge $500 for a scan fee. And that generates about $1,000 in monthly revenue. Learn more about the Vimago and the Pico at epicaanimalhealth.com. Learn about the Epicare warranty, service, and maintenance program there. You may also download our CT Buyer's Guide off of our website. If you are looking to purchase CT, this buyer guide is a must-have. You may also register for our CT 101 education course, which is taught by our chief radiologist, Dr. Bob O'Brien. If you would like to see other cases just like these, you can scan this QR code and it will take you to my YouTube channel where I have over 100 cases that were scanned by Vimago or by Pico. Thank you for giving us your time today. Have a great day.